Hi, good evening. My name is Hannah, and it's my pleasure to welcome you to tonight's webinar, Vaccines 101. Unfortunately, there has been significant misinformation around vaccines, particularly recently, as well as around the diseases they prevent, their efficacy, and their possible side effects. So we are fortunate to have three wonderful and passionate pediatrics professionals here tonight to share more about this topic and to answer your questions. I'll do some brief introductions. We have Dr. Sylvia Bank. She is one of our pediatricians working at Howard County Pediatrics. She completed her undergraduate studies at MIT and her medical school at NYU School of Medicine. She's married to her high school sweetheart and has 4 children, and she has practiced primary care for over a decade with us. Brendan Koning is one of our pediatric nurse practitioners who has been caring for children for over 12 years, working at Frederick County Pediatrics. He received his Bachelor of Science in Nursing from Florida Gulf University and received his pediatric nurse practitioner degree from the University of South Florida. He has been married to his husband, Sean, for over a decade. And finally, we have Dr. Vivian Carlin. She's a pediatrician based in San Antonio, Texas. She went to medical school and did her pediatric residency training at Johns Hopkins. She and her husband have been married for more than 20 years and have 6 children. She also co-hosts the wonderful podcast 10 Kids, 2 Dogs with Dr. Bank, who is also with us this evening. Before we get started, I did want to let everyone know that your cameras are off and your mics are muted, so you do not need to worry about any background noises. However, we absolutely encourage you to ask questions. So to that end, please feel free to go ahead and click on the Q&A option in your chat and enter any questions that arise at any point, and we'll answer all of those at the end. You're also able to enter questions anonymously if you prefer. So if there's something you don't feel as comfortable asking, you can go to the little drop down and change it to post as anonymous user. And with that, it is my pleasure to turn it over to our presenters for this evening. Thank you so much.
Yes, thank you everyone for attending. I'm so excited to have you here. I just want to let everybody know that neither myself, Vivian, or Brendan have anything to disclose as far as relationships with any other medical entities. So first of all, I just wanted to give a summary to all of the attendees about what we want you to get out of today's Vaccine 101 webinar. And here are the 3 take-home messages we want you to hear. Number 1, vaccines are well studied and safe. Number 2, vaccine preventable diseases are terrible childhood illnesses. And number 3, if we stop vaccinating, these terrible childhood illnesses will return into our population and our kids. So those are the 3 take-home messages we hope that you get from today's talk. And just to summarize, we're going to go into more detail about those 3 points in our talk today. So first of all, I'd like to introduce Brendan, and he's going to talk a little bit about vaccine safety and how we monitor the safety of vaccines.
Yeah, thanks, Sylvia. Let's go ahead and start talking a little bit about vaccine safety and how that's monitored here in the United States. It's a 2-layer system that we use here in the US. The first part of our system for vaccine safety monitoring is called VAERS, which stands for Vaccine Adverse Event Reporting Systems. Now, this is a system that's built to be like a passive catch-all. So that information, instead of us going out for it, it's coming to us to be able to evaluate for potential safety concerns. VAERS allows anyone to report any possible safety concerns in relationships to vaccines. There is no gatekeeping that comes to this system. So let's say you were to receive a vaccine and you felt like there was a negative outcome. You would be able to report this to VAERS, and through this passive data collection, we can start to see some concerning trends that may be developing that would need further investigation. Now, the key concept to this VAERS system is that anyone can report, not just clinicians, not just us, not just pharmacists, but anybody. And with these, and with that key concept, there are some limitations. Sometimes we get some incomplete information, sometimes we get inaccurate information, and sometimes it's just coincidental. Like, here's an example. let's say you received a vaccine and later that day, your toe turned blue. Well, it doesn't necessarily mean that that vaccine turned your toe blue. Maybe it was the fact that you stubbed your toe getting out of bed that morning. Does that make sense? So you may have had something occur to you on the same day that you received a vaccine, but it doesn't necessarily mean that what happened to you is because of the vaccine. And that's a really important distinction. Once VAERS identifies concerning trends, that's where the next layer of our monitoring system comes in, and that's called VSD, or Vaccine Safety Data Link. Now, this is an active system. That means that we're actually going out there and trying to find some of that data, as well as being able to interpret some of the information that VAERS is sending to us. We actually have researchers that their entire job is to run these reports weekly through electronic medical records. So we're not only just waiting for things to come to us, we're actively trying to find problems. There's actually been some really cool examples of where VAERS and VSD have helped identify potential harms from vaccines. VSD noted that can be a rare immune-related rash that's associated with the MMR vaccine. VSD famously identified a concern for a rare GI condition that was actually a result of an older version of the rotavirus vaccine. That information actually resulted with that vaccine being pulled from the market and a new, safer version was implemented. And that's a perfect example of why our safety net is working exactly the way that it should. For me, that's a huge relief. I always want to know that there is consistent and ongoing investigation to look into these potential harms. But one of the things that we need to remember is that these types of data points can be used as kind of a launching pad for misinformation. You may read articles where people are using information or data from VAERS. That's that first part of the way that we get that data that any person can put into that system. And people will draw a correlation or a connection to that and try to convince us that it is a conclusion. Remember that toe we were talking about? You may see a report that the MMR vaccine could cause a blue toe. That's the type of misinformation that you may see when people are using this two-layered system in a way that it wasn't intended. Remember, it takes both parts, both the passive information from VAERS and the investigation through the active data collection through VSD in order for us to draw the conclusion. And one of the best parts about this, it's not just the United States. Vax Safety in Australia, Canvas in Canada, 127 other countries around the world have active systems to monitor for vaccine safety. That's a whole lot of eyes looking at vaccines. With a little bit of a better understanding now about how we utilize our systems to be able to monitor for vaccine safety, let's focus on a few of those areas of information. Sylvia, why don't you get us started?
Sure. One of the things that we really wanted to address today before anyone asked any questions was this topic and this trend that we see where people believe that vaccines may be the cause of autism. And we wanted to spend some time to address that today. First, I want to give a little bit of a historical perspective. I think a shift in how people felt about vaccines happened around the time of the late 90s when there was this theory that got proposed that maybe the vaccines was a trigger or a cause of autism. I think this was a milestone for the history of vaccines and how public opinion kind of shifted and changed at that point. There was this paper that was published in a medical journal called The Lancet in 1998, and that was a paper that proposed a theory about a possible association between autism and the measles, mumps, and rubella vaccine. And from a historical perspective, this theory kind of planted the seed that led to more and more public opinion about this possible link. However, from a pediatrician standpoint, we know as doctors and healthcare providers that this original paper in The Lancet from 1998 was later found to be completely fraudulent. The authors all redacted their statements, and that paper is no longer considered medically valid in the medical community. And even so, subsequent articles have been published. Numerous very large study articles have been published since that seed was planted that showed no association between the measles, mumps, and rubella vaccine and autism. As scientists and doctors, we've personally looked through this data and feel sure that the vaccines don't cause autism. If any of the listeners are interested in looking more into these articles, I will put a link to all of the ones that we've found and we found to be medically valid, so you guys can look through them or review them for your own. In addition, the Johns Hopkins School of Public Health has a website that's called Vaccines Don't Cause Autism. Why do some people think that they do? And it really goes through step by step what happened with this study that I talked about, and also has links to all these big population studies that have been subsequently done looking at this exact question. And I will give you guys a link to that as well. It's very informative. If we look at vaccinated populations versus people who are unvaccinated populations over multiple studies, over hundreds and thousands of children, we see no increase in the rate of autism between vaccinated groups of children and unvaccinated groups of children. And that's pretty compelling that vaccines are not the cause of autism. The second area of controversy we would like to address today is related to why the vaccine success can undermine its implementation. And I want to turn the tables over to Vivian so she can tell us a little bit more about this.
Sure, yeah. Thank you, Sylvia. So I want to address two common types of misinformation that are seen on social media that anti-vaccine groups will use to promote concerns about vaccines. Okay, and here's the first. So people, like Sylvia said, people love to use the success of a vaccine against itself by making claims that the vaccine is more dangerous than the disease. So let's take a look at a popular claim that was going around social media, and it was this. Between the years 2000 and 2010, 10 patients died following the measles vaccine, while only 2 people died from the actual measles illness. Therefore, the vaccine is more dangerous than the illness. Let me say that one more time. Between 2000 and 2010, 10 patients died following measles vaccination, while only 2 people died from actual measles illness. Therefore, the vaccine is more dangerous than the illness. That's the conclusion that was made. So let's analyze that. So first of all, 10 people died following the measles vaccine. That is what Brendan is talking about. They're pulling the data from VAERS. It is true that 10 people died following the measles vaccine, but remember, that is just passively collecting information. In other words, these events were correlated in time, and that doesn't mean that one caused the other. So over 10 years in which millions and millions of doses of measles vaccine were given, the fact that there were 10 deaths within a certain period of time following the vaccination being given is absolutely what would be expected coincidentally. And that's the type of thing that gets investigated further to see, is there an uptick in signaling in this report that would cause us to think that there could be causality that we're missing. And when that's investigated, that's absolutely not true. This was purely a correlation in time, not causal. On the flip side, if we think about it, claiming that only 2 people died from the actual disease in that decade is crazy. I mean, this is like called the success paradox, because the reason only 2 people died from actual measles infection is that nobody was getting measles. I mean, measles had been declared eliminated in the US during that decade. And while, yes, there were sporadic cases, there were no outbreaks of measles. So only 2 people died from measles because virtually no one was getting the measles. If we contrast that to before the vaccine was introduced, which was in 1963 in the US was seeing approximately 500 measles deaths every single year. And that's what we would expect if measles had been widely circulating at that time. I want to address another type of very common misinformation, and that is that people love to reference the list of side effects on the manufacturer's packaging insert that comes with the vaccines. So let me explain how that process works. So when vaccines and any medications are in development, any symptoms, any negative occurrence while it's in testing has to be reported, whether it's thought to be caused by the vaccine or not. So, for example, if you're in a clinical trial for a medication and after being given the medication, you're in a car accident, that's reported. And the question is then asked, is it possible that this medication caused impaired driving? If the answer is yes, that it's possible, then it's listed on the package insert as a possible side effect. It's very similar to those TV commercials where a whole list of possible side effects, including death, is rattled off at the end of the commercial. This medication may cause. So similarly with vaccine development, this is kind of like VAERS. Any side effect that has occurred during vaccine development is reported. If it is possible that there was a link, then it is put on the package insert as a legal protection. And I'll tell you the story of what this really reminds me of. I've spent most of my career in pediatric emergency medicine. And at one time I was testifying in a child abuse case, and the criminal defense lawyer asked me, is it possible that the injuries that you saw as the treating physician were caused by a heavy glass vase that fell off the table and hit the child? And, I'm thinking, well, anything's possible. I mean, the answer to that has to be yes. And then it's like, okay, no further questions. Like, that's very frustrating. But this is very similar. This is a legal thing. If any side effect occurred that was deemed possible to be from the vaccine, it's put on the vaccine insert. That's very different from then what the FDA then does with that data, monitoring that all of these occurrences to see if anything is occurring above normal or above the general population, what we would expect. And if there's any reason to think that it's actually probable that the vaccine was causing these symptoms, or a medication if that's what's in development. If at some point it looks like it's probable that there's causality, then the drug or vaccine is pulled, goes back into further testing, or the recommendations and warnings changed for how it's used. So you have to be very careful putting too much weight into the package inserts. So of course there are many things we could talk about as far as common streams of how misinformation is given. Those are just two of them to give you a taste that are pretty common. A lot of rebuttals to vaccines will fall under these categories. Okay, but aside from that, what I want to do now is turn our attention to actually discussing vaccine preventable diseases, because part of the problem that we have now is that parents are being bombarded with misinformation on the danger of vaccines, and we're living in an era where most of us don't really have in our memory the actual danger of these diseases themselves, because vaccines have been so successful in preventing them. We don't remember when pertussis was rampant in the 1920s, in the 1990s. We don't remember when diphtheria was rampant in the 1920s. Like we have successfully prevented these awful diseases. So it's very difficult as a new parent to weigh the pros and cons when you don't fully understand the disease itself. So one of our hopes is really to empower you to make good decisions for your children by giving you the knowledge of how dangerous these diseases are. And the one that I'm going to start us off with by talking about is measles. And now, as probably everybody knows, thankfully, measles has remained on the recommended schedule by everyone, the AAP, the CDC, and the HHS. But the reason I want to use measles as a case in point to start this discussion is because I think it illustrates two things for us. And that's first, measles is often referred to as the harbinger of what's to come, or the evidence that our shield of protection from herd immunity is wearing thin. And that's because measles is so highly contagious that we've known that it would be the first illness we would see circulating when vaccination rates started to decrease. And then secondly, I want to use measles to illustrate that all of the diseases that have been selected for vaccine development are serious illnesses with significant hospitalization rates and even mortality or rates of death. So if we just look at measles, in 2025, the CDC data on measles is that there were approximately 2,300 cases of measles. And of those cases, 11% of patients were hospitalized. And under the age of 5, approximately 1 in 6 were hospitalized. And what we know as clinicians is we effectively manage a lot of illness at home. I mean, we've gotten very good at instructing patients on what to do, how frequently to check in with their primary care provider, how to hydrate their child at home. We can give Zofran for vomiting, how to support their breathing if needed at home. Like there's a lot of measures we can do to keep children at home. So as a clinician, when I hear of a child being admitted to the hospital, I know that someone was concerned that if that child just went home, there was serious serious risk of deterioration or even death. Like they needed to be managed in the safety of the hospital. And for measles in particular, the symptoms that lead to hospitalization, it often can cause significant respiratory symptoms, severe coughing, difficulty breathing, cyanosis, that turning blue around the mouth. It can cause severe dehydration, vomiting, and diarrhea, and that inability to keep fluids down. It can also cause neurologic issues, high fever, headache, confusion, sometimes even seizures. And it can cause severe superinfections from other bacteria, like pneumonia or other severe infections. So measles is not just a rash. It is for some, but for a lot of these kids, 1 in 6 under 5, it is so serious that it led to hospitalization. And then, of course, measles had an unacceptable mortality rate. So in 2025, there were 3 deaths from those 2,300 cases of measles, or approximately 1 in 500 to 700 is the statistic that I've seen most commonly. And then another symptom of measles that I don't think people were really aware of until this happened in South Carolina, and then it got put into the news, which we've known as clinicians, is that it was also notorious for causing this encephalitis, which is like a global inflammation of the brain. And that has very serious consequences. It can often lead to permanent neurologic injury, if not death. And what's really scary about this is that risk from measles, that brain swelling, it can occur during the measles infection, or the child can completely recover, and then it can occur up to 7 to 10 years later. And if you want a really good example of this, Roald Dahl, the popular children's author, like Charlie and the Chocolate Factory, all of those, he wrote an essay about his daughter who sadly died from this encephalitis before the vaccine was widespread. And he describes her course and said she was well on her way to recovery. He thought she was getting better. And then all of a sudden, she started having these neurologic symptoms of having difficulty speaking. And then 12 hours later, she died. It's a really powerful personal story of it. He writes that to kind of encourage people this many decades ago of the importance of vaccination. So far in 2026, there have been 1,500 cases of measles. So we are projected to be on course to have our highest measles year of late. And, we'll see as that data comes out. But, we're familiar with measles because it's now in the news more as we see these outbreaks. But I could do the same when I talk about Hib and Prevnar and Pertussis and the other diseases that are on the vaccine schedule. In fact, one of the things I like to talk to parents about is a lot of parents don't know what Hib is. They know the acronym from the immunization schedule, but they're not familiar with the disease. That's a bacteria, Haemophilus influenza type B. That's where the acronym comes from. And this bacteria was notorious for causing invasive, life-threatening infection. And I'll often point out to people, and I, with some frequency have people relate to this. Have you ever heard somebody in like your grandparents' generation talk about this lore in the 70s or 80s that if your child had an ear infection, you better quickly go to the doctor because if it wasn't treated with antibiotics, it could cause meningitis or death? Well, that actually was true, and that is because of Hib. And the Hib vaccination came out in 1990 and really put that to a halt. Then after Prevnar came out in 2000, we're now at the point, as some parents may know, where we can actually say, oh, your child has an ear infection. If there's no other risk factors, we can do Tylenol and Motrin and wait for a day or two and see if it goes away on its own, right? But that couldn't happen pre-Hib and Prevnar because of these really terrible bacteria that could masquerade as just an ear infection and then within a matter of hours or day progress into this really life-threatening disease. So the takeaway from all of that is to use those as an example that all diseases are on the vaccine schedule were chosen for a reason. It's not that measles is worse than the others. It's just that it's so contagious. We've always known it would be first, but it should be an example to us of what is going to happen with these other diseases when vaccination rates drop. So as you know, there's a handful of diseases that have been now moved into a category of shared clinical decision-making. And I'm going to turn it over to Sylvia to start talking about some of those.
Yeah. So, a lot of people are super afraid of polio. They know about the measles. These are ones that a lot of the population are rightfully afraid of and know a lot about. But I want to transition and talk about some of the diseases that maybe people don't know that much about. they've heard of it, but they're not sure or don't know why it's so bad. So we're going to kind of shift to some of these illnesses. And the first two I want to highlight are the hepatitis A and B. So historically, what we found is, we didn't know that about these hepatitis A and B viruses that are causing this disease to start with. What clinicians see is they see people that are sick, right? The first thing they see, they don't know why people are sick, but they're sick. And hepatitis is general inflammation of the liver, one of the organs in your gastrointestinal tract. And the liver is really important because it removes toxins from the bloodstream, and it's kind of known as the body's chemical processing plant. So the liver also excretes bile, which helps in digestion. People cannot live without a liver. This is something that needs to be transplanted, if the liver is not functioning. So a vital organ in the body. And in the 1950s and the 1960s, doctors were observing sick patients with this liver inflammation. They didn't know why, but they saw that these people had liver disease, or hepatitis is what they called it. And some of these patients would kind of be sick and get better, and others would go on to develop a continued liver problem that led to liver scarring, a condition known as cirrhosis, and that could eventually lead to liver failure, and you need a transplant. Some of these long-term liver disease people were also getting liver cancer at a higher rate. So in the 1950s and 60s, they were seeing people with liver disease in the population. Later, through studies, they wound up finding out why these people were suffering from liver disease, and that was because of the viral infections of hepatitis A and hepatitis B. They're separate viruses, but they caused liver disease. The hepatitis A virus was the acute form, the one that they would get sick for a while and then fully recover. The hepatitis B virus was the one that caused the long-term liver scarring and potential risk for liver cancer. So through science and technology, they discovered these two viruses. When they moved even further, they discovered that this hepatitis B, this kind of long-term one, the vaccine that is offered to children when they are first born in the newborn nursery, they saw that hepatitis B infection was sometimes deemed as the silent killer, because people can be infected with hepatitis B before they have any symptoms. They can kind of carry this infection for some time, being contagious to others, like their partners, or mothers are contagious to their unborn babies without even knowing that they have hepatitis. And that became a large concern, because if a mother had hepatitis and didn't know, gave birth to a baby, that baby would be at risk for having hepatitis and lifelong liver disease. So this is kind of when they started seeing that this was a big problem, and how contagious and how hepatitis gets transferred from mother to baby. They developed the hepatitis B vaccine, after they discovered the virus, and they found that this vaccine is really, really benign. It doesn't really cause a lot of side effects. It works very effectively in a 3-dose series, and it was deemed at that time that this should be given in that newborn period to help protect babies from hepatitis. Once they have the hepatitis B vaccine series, they're not at risk for long-term liver disease and not at risk for cirrhosis or liver scarring or liver cancer from this disease. So it was one actually of the first cancer prevention vaccines that was developed. So this is kind of very important to know of what is hepatitis, where did it come from, and why we immunize against it. Hepatitis A is a vaccine series that is offered typically at the 1-year-old visit and maybe the 18 months. Sometimes it's at the 15 and 2-year, depending on the time of year. And that one helps prevent that acute form of hepatitis. You may hear in the news of hepatitis being transferred through green onions, or green peppers from Ohio or green onions from California. Sometimes this form of liver inflammation gets transmitted through food, and that can be completely prevented with a 2-shot series. So if you want to avoid a lot of the common liver diseases that affect people in America, getting the hepatitis A and B series is highly recommended. The next kind of new or the disease that I want to move on to that is covered under this umbrella of shared clinical decision making now is a bacteria called Neisseria meningitidis. And this is the one that causes, we often call it the meningitis vaccine that's offered to your teenagers at the 11-year-old visit and the 16-year-old visit. That one is one of the meningitis vaccines. And then there's another meningitis vaccines that's offered to children that are going to college called the meningitis B vaccine. Although the bacteria is called Neisseria meningitidis, we also call it meningococcus. So those are kind of two ways that doctors refer to this bacteria that is known as, the meningitis bacteria. Meningococcus is this bacteria that causes a range of infections, which includes meningitis, but can also cause other infections. Teenagers and young adults are particularly at risk for this based on how the bacteria spreads through shared drinks, closed living quarters, and everyday social interactions. It is a horrible disease that begins like a flu-like illness, and it can progress rapidly to death within 6 hours. So people that survive this fast-moving infection are often left with hearing loss and sometimes even limb amputation. You lose your limbs when you get infected with meningococcus. Just like the hepatitis B, some people can carry the meningococcal bacteria without getting sick. And this is how it gets contagious and spread throughout a population. And this is how it causes these outbreaks that people hear about, usually in colleges amongst like young adult settings. And that's how the disease spreads. I want to highlight a recent outbreak of a meningococcal infection caused by the meningitis B bacteria. This happened very recently in a series of college campuses in the UK, so in the United Kingdom. The two universities were the University of Kent and the Canterbury Christ College. There was a club, like a young person's club called the Chemistry Club around Canterbury, where they kind of deemed that that was the site, the super spreader event where this meningitis B outbreak happened in the UK amongst unimmunized people. And that just happened earlier this month, March 5th and 7th. And from that Canterbury Club super spreader event, 4 colleges and grammar schools in the area had children and young people that were infected. There were 27 confirmed cases of meningococcus. 11 young people were hospitalized and 2 people died from this mini outbreak. All of this is vaccine preventable, and previously healthy young students that are getting this infection and dying. This was also considered a super spreader event where, based on people who went to this club and then spread out throughout Europe, they started tracking cases in London, and it spread as far as France. So this is how quickly this meningitis outbreak from the chemistry club spread. And as many of you may remember from the COVID time, it became this public health measure to stop this spread and stop people from potentially getting infected and dying from meningococcus. They launched in the UK an emergency vaccination program for meningitis B from the colleges around, where 5,000 doses were given to the students there. And then the government released another 20,000 doses of the meningitis B vaccine to hopefully contain this rapidly spreading deadly infection. So just imagine if your college student was in the area of this outbreak. Why panic with the exposure? It's better to get vaccinated before the exposure ever happened to prevent the risk of meningitis, rather than kind of panicking afterwards and trying to get vaccinated if you were, in contact and infected. So I just want to paint a picture of how scary this rapidly progressing death within 6 hours meningococcus can be, and how very reassuring and easy it is to receive this immunization series during the teenage years to prevent this type of infection. We want to now move on to another disease in this similar category known as rotavirus. And I'm excited to pass the mic over to Brendan and have him talk about that.
Oh, thanks so much, Sylvia. One of the things that you guys are going to really realize from our conversation today is that concept of something that is incredibly infectious. You know, each of us have talked in turn about how easy it is for many of these diseases to spread, and unfortunately, rotavirus is no different. For those of you out there that have toddlers or have had any toddlers, you know how difficult it can be to contain the diarrhea of any child or infant, right? Now imagine a diarrhea that is so horrible that it is the #1 reason for diarrhea-related deaths across the entire world. It's insanely contagious. It takes only a few of those viral particulates to cause a rapid infection in others. And once infected, it can cause life-threatening dehydration that usually requires hospitalization for children. And that's just being infected with it. But one of the most concerning parts to rotavirus is that there is a disproportionately increased risk for neurological complications. In fact, up to 24 of all those who are infected with rotavirus can develop those complications. But more concerning is that rotavirus has a specifically terrifying one of these neurological complications, which is the type of brain swelling, that encephalopathy that we've talked about with other diseases. Up to 6% of individuals that are infected with rotavirus can develop that type of life-threatening brain swelling. Other viral diarrheal illnesses, they don't have that type of a risk. So it's one of the reasons why rotavirus was chosen to be vaccinated against. Those who are youngest are the ones that are most at risk of dying from rotavirus. And in a world where most children will have been infected with rotavirus by age 5, I'm thrilled that there's a vaccine that has been developed to protect the ones that are most vulnerable. Now, when these patients who are infected with rotavirus arrive at the emergency department, there are a lot of times we have to use highly invasive methods to rehydrate these kiddos. Methods that we tend to use in things like trauma patients, where these kids are so dehydrated that we actually have to use a drill to go into their bones to deliver life-saving rapid rehydration. But thankfully, after the rotavirus vaccine was implemented, we have seen yearly reductions of emergency department visits and hospitalizations past 90% when compared to those pre-vaccine levels. One of the most striking results of this vaccine, though, has a lot to do with the economic impact. Before the vaccine, the emergency departments were seeing up to 245,000 visits a year that were attributed to rotavirus, and now those numbers have plummeted thanks to the vaccine. In fact, in the United States, the total annual costs were up to $1 billion in relationship to rotavirus. But after we implemented the vaccination during 2008 to 2009, it was estimated that we saved $242 million in those costs. And it's not even to mention the costs that we're saving for schools and, of course, parents' pocketbooks. Because, I mean, you know how it is. Rotavirus doesn't know that you still have to pay for childcare, even if your child is ill. Certainly the daycares don't seem to know that with any of the other viruses or illnesses that we don't vaccinate against. Now that we've taken some time to talk a little bit about these diseases that we're asked to use mutual decision making for, we want to start to invite you all, the viewers, into our conversation. So let's see what questions we have from the audience. Hannah, what do you have for us?
All right. Thank you. That was very educational, and I speak about this frequently with my team. So I'm going to start reading through the questions, but please remember you can click the Q&A button if you have any questions, or you can use the chat button. I know on the mobile app sometimes it doesn't work as well. You touched a little bit on this, but we have a question asking explicitly, the CDC is saying we need many fewer vaccines. Why are you saying we need so many? And I think that that's not necessarily the whole vaccine course you introduced today, but the American Academy of Pediatrics does have a larger list of mandatory vaccines than currently published by the CDC.
It's an excellent question. From my understanding, what has changed and what has been recommended has a lot to do with the Danish vaccine series. In Denmark, there is an incredibly high rate of vaccine uptake, well higher than we have in the United States. So when they're talking about reducing the overall vaccine amount, they're seeming to be pointing toward like a mandation or mandatory vaccine schedule. If there were the same amount of uptake when it comes to these vaccines, we may not have to mandate them. But when we're talking about reducing them, it's not that they're not available. It's just that they're not mandated in order to be completed, from my understanding.
Yeah, and I think that in the a lot of people like to compare us to the Denmark population. They have to know that the way that Denmark provides healthcare is very, very different than the way that healthcare is provided in the United States. The amount of monitoring, follow-up, and decision making is much more contained in the smaller population of the country of Denmark. And even though they are a developed nation, their healthcare, their population, and the diseases they see there are different than the diseases that we see here and the healthcare that we have here. Like I mentioned in a couple of my descriptions, how some of these illnesses can be silent. They can be unknown to the carrier that they're even carrying these bacteria or these viruses, and then things can spread even further. Sometimes with very tight monitoring in a healthcare system like they have in Denmark, that all can be covered and every single patient is known and every single serology of every patient is known in that type of medical system. We don't have that type of medical system here, and the amount of hypervigilance and coverage we need to do to protect our population is very different than in America compared to some of these countries that they like to compare the vaccine schedule to. So hopefully that explains to people why things are different here than they are, and our schedule is different than what they are in other countries.
I'm going to ask another question. Thank you. It came up most recently, but I do think it's important, so I'm going to skip to this one. So we received a question and it says, can I ask why there are any side effects with any mandatory vaccines, including death possible? That is what the paperwork given to me at the doctor's office says.
So part of the paperwork and I think Vivian addressed this very well in her discussion of the insert and the package insert associated with vaccines. The way that research, the FDA and research is done on a new medicine, including vaccines, is that as they're doing the trial, the safety trial for the population, the people that are receiving the medicine or the vaccine in the trial report every single thing that may happen in the same time that they're in the trial. So if, let's say, someone's in the trial and receiving a vaccine and death occurs from a car accident or some other cause, that still needs to be reported in the vaccine insert. Even though the causality is not established, the rules of the FDA state that during the clinical trial, if something happened that may be a possible link during the trial, it has to be on the insert. And just like Vivian mentioned in her description of this, when you hear on the commercial about, Remfaya or whatever, like, liberate your life with Remfaya, and you see these people hiking in Arizona, like those commercials will talk about how great the medicine is. And at the end of every commercial, you'll hear, this medication should not be given to people who are allergic to Remfaya and it may cause death. Like every single one that you hear on TV, they have to report all of these things. And it's not saying that it's necessarily causal, but because of the way that we develop medicines and vaccines, it must be reported and it must be told to you. That correlation, if this medicine caused death and they knew it did, it would not be released for public consumption, right? I
Yeah.
hope I explained that well.
I think that was a great explanation, specifically with the last point of that question. I want to go with the first part here, which is about side effects. when you receive a vaccine, we intend for your immune system to have a reaction when we do something with that. And when we talk about side effects, injection site redness, swelling, pain, fever, discomfort, these are expected responses that your body is having to something that we want this. I literally got my Tdap vaccine today. My 10-year timer went off on my phone, and my arm hurts today. And it's certainly discomforting. Don't get me wrong, but when we're talking about these types of diseases that we're vaccinated against, we're talking about that risk reward type of conversation, right? My sore arm, maybe a little bit of a temperature that I might get tomorrow from my vaccine is certainly way less of an issue than like tetanus, something that most people pass away from, right? Or pertussis, something that I could potentially harm those around me that I care for. So remember that for, this moment in time, when we deliver something that's going to craft a robust immune system, there is going to be some sort of an effect most of the time when we deliver those vaccines.
Thank you. And kind of along the same vein, we received a question around vaccine spacing. So this individual is asking, would spacing the vaccines out reduce the side effects or be safer?
Sure, I'll take this one. So they make these combination vaccines, that reduce the number of needles that children get, and they receive multiple different types of vaccines in one needle. If one thinks about, like, for example, the DTaP vaccine, which is kind of presented as one, it's actually diphtheria, pertussis, and tetanus. So technically that involves multiple illnesses that you're vaccinating against at once. And sometimes they combine that with like the polio vaccine, the Haemophilus influenza B, and or the hepatitis B. So they make these combination vaccines to help reduce the number of needles that children get. I feel like when you give these diseases in combination, they help synergistically improve the immune response. When you are responding to one vaccine and the other vaccine is given, they can additively help to boost the immunity in that one shot. So in my opinion, even though they may seem like Brendan described, the side effects are worse, sometimes that means your immune response is better. Those two things are not mutually exclusive. They're actually the same thing. So a lot of parents are fearful of that fever that happens with the vaccine. They're fearful for that, fatigue or maybe irritability. But, to us clinicians, sometimes the fever means that your body is responding, your immune system is developing immunity to those illnesses you've just been immunized against. So they're kind of a negative side effect. Not everyone gets a fever, but in my opinion, sometimes that means the vaccine is working. So when you're giving multiple vaccines together and you have fever, that could mean that the vaccines are taking effect. Your child is developing immunity. So it's a different way of thinking about quote unquote side effects. And hopefully that kind of explains why sometimes they're given together to boost that immune response even more.
Yeah, please.
Go ahead. I want to say a couple of things about this question too. I mean, first off, we know that there are higher risk groups for infection, and it tends to be the very, very young and the very elderly, right? There's this bimodal curve where we see this increase in infection. And all of these vaccines were developed to be given on a timeline that was most effective. And a number of these illnesses, like pertussis, for example, like Hib and Prevnar, which I mentioned, those infections carry a much higher risk in younger children than in, a 20-year-old or a 30-year-old, right? Similar, I talked about the hospitalization rate being so much higher in measles in children under the age of 5. So all of this vaccination development was taking into account when are the windows of time that we most need to protect people. I will make a little side comment on hepatitis B because it kind of also goes into this timing of vaccination, and Sylvia hit on this, but there is even up to a 6-month window in which a woman can have hepatitis B and still test negative for hepatitis B. So that vaccine was chosen in the newborn period because we knew that that would prevent it, even in that case where you don't know yet that you have hepatitis B that you could transmit to your infant. That being said, That's always been shared clinical decision making and a very important discussion to have with your doctor about risk factors and other things in making the decision about that vaccine. The other thing I want to say about timing and spacing out, I will admit we don't have a lot of great studies on this, but there is some studies that have been done in Denmark. And we often reference Denmark because Sylvia alluded to the way they set up their healthcare. It's much easier for them to look at large numbers of data. And they actually have done some studies in looking at-risk populations for autism, which would be considered siblings of patients with autism, and looking if spacing out their vaccines made any difference in the rate of autism versus giving the vaccines on schedule. And there was no difference that was found. So again, I don't have a lot of studies to cite, but that has been looked at in some studies, which we can post.
We did have, you just brought up Hep B, Dr. Carlin, and we have a question specifically about it. And I think you did address this, but our audience member is asking, can you expand on why the Hep B vaccine for newborns became a recent conversation and why this vaccine is still important even when the mother tests negative? So if you want to hit on that one more time on the testing window for the mom.
Yeah. So again, that was chosen because it's most effective to prevent that, neonatal transfer of infection if it's given at birth. And that way, even if the mother doesn't know that has hepatitis B, the newborn is still protected. I will say, I think we feel as clinicians when this announcement was made that we're now going to move these vaccines into this category called shared clinical decision making, there was a little bit of, well, that's what we've always been doing, right? Like Hep B is a great example. This is a great one to be having that discussion with your doctor. So hopefully we've always been doing shared clinical decision making on this.
And I would add, and because we did have another question about the CDC, there has actually been a block on the CDC's new recommendations. And just so everyone is aware, the CDC recommendations were not made based on new evidence or new studies. There was no new information that led to that. So just wanted to put that out there. Here is our next question. As a vaccinated individual / child, can you speak on what can happen if there is an outbreak of something such as measles or rotavirus for diseases that we have not necessarily seen much of in our lifetime? I imagine the outbreaks would be widely seen in daycares and/or school settings.
Yeah. So one thing, and maybe Vivian can attest to this, living in South Texas and having the measles outbreak so close to her home and where her children go to school. When you are vaccinated against measles and there is a measles outbreak in your community, you are protected against that outbreak. So this is why we encourage everyone to get vaccinated, because they are protected if an outbreak occurs. Now, there are people in a population, A, that can't get vaccinated, B, they get vaccinated and because of immune problems, they don't generate an immunity to it, and unvaccinated people are at risk in a population where, for example, measles is spreading. So that is why we encourage everyone to continue to vaccinate, because it is protective for the most part. They give statistics. With the first measles vaccine, you're 91% protected. With the second one, the booster, you're 99% protected. So obviously there's a small percentage of everyone who gets it who might not be fully protected, but it is the one way to ensure if there's an outbreak in your area and your child is exposed, that their risk of getting the disease is drastically reduced.
I do want to, just as the non-clinical person, something that was powerfully told to me by this team is these are considered vaccine preventable diseases. And I think that there's been some confusion about like the efficacy of flu and COVID and moving that as a parallel to the efficacy of the diseases on the vaccine schedule. So there's a very big difference. Flu and COVID are very important. It's obviously going to increase your resistance and hopefully make you suffer less if you get those. But truly the vaccines we're talking today will very much prevent to a greater degree than some of these kind of seasonal vaccines that consistently change year over year. So I did want to emphasize that with that question. There is a difference.
Hannah, you bring up a really good point that, people, when people are really studying viruses and bacteria, the virus is notoriously known for shifting and changing from season to season. That is one reason why you get the flu vaccine every year instead of just once when you're a child. The nature of the vaccine is that it shifts and drifts and shares genetic material with other flus and other animal populations that change the virus enough that you can get infected multiple seasons, multiple times with the flu. Measles is not like that. You get the measles doesn't shift, the measles doesn't change. You get the measles vaccine and you are protected against measles for life. And when a vaccine has enough percentage, or if population has enough percentage of people that are vaccinated, 98% or something, then it eradicates that illness from the population. So when those numbers of vaccinations drop, like I said in the introduction, we will see these vaccine preventable diseases creep back into our society, which we've already started to see with the measles.
I'm going to do some rapid fire. We have 5 minutes remaining, but I'm sure we can stay a little late if anyone else has burning questions they want to ask at the
and
end.
Hannah, we also have some concluding thoughts that we would like to do at the end as well.
We're going to go rapid fire, so we're going to give succinct answers here.
All right.
Can you share guidance on travel to a place experiencing a measles outbreak with vaccinated kids? One of my kids is younger than 4, so they only have 1 MMR, so that includes measles, what we were discussing, dose so far.
Yeah, so this specific question, the measles vaccine can be boosted after the age of 4, but you can get your second measles vaccine, I believe, as close to 16 months after your first. Yes. So if you are traveling to an area where measles is an outbreak and you've had the first one and you're 3 years old now, you can get another measles vaccine to protect yourself before going there. So ask your doctor. Ask your doctor in specific about these particular cases, and you can have a discussion on how best to protect your child if you are traveling into these areas.
And this is not new to us. We are having these conversations today, so we're ready for it.
Yeah.
Okay. Last one. We talked about this, but this person might have joined a little later, or we'll see. It says, is there a link between vaccines and autism? A close family member believes her son's 4-year-old vaccines dramatically affected his behavior and speech. So would it be beneficial to spread out the 4-year-old vaccines? I think this kind of ties together a couple of points.
I mean, hopefully if you joined late, I said previously in the webinar a very clear description about where the link between autism and vaccines came from and how that has been debunked on several levels. So I would suggest maybe you go back and listen to the taping of the webinar just to kind of check that out so we don't repeat in the interest of time. But in addition, I think the second part of the question was
so would it be beneficial to spread out?
Right.
So I think
I think Vivian made this point that the vaccines are given at the particular age where the diseases are most at risk for the child. Like she said earlier, the very young and the very old are the populations that get more sick and more affected by illness and disease. So delaying a vaccine because of this one concern really kind of misses the window of protection when you want to be protected most against the disease. And those windows of protection are very carefully planned out and dictated based on when the disease is and when your child is most at risk for the disease. So the spreading out philosophy doesn't necessarily make that much sense if you're really trying to do your vaccine preventable disease prevention at the right time.
And when we're most at risk for the complications of developing these vaccine preventable illnesses, right? All of the other things that could happen afterward. The other thing to remember too, that I always like to highlight with this question is if you give your immune system a trigger, you're going to have an immune response, right? If you take that trigger and let's say we're talking about these vaccines, let's say you get 3 of them, right? And if we take those 3 triggers and we spread them over time, there's still a chance you're going to have that same level of vaccine or immune response. So putting them together and getting them done at one time can create just a singular moment where your child is experiencing these discomfort. Well, yes, but part of this vaccine process, right? But at least it's a one and done instead of 1, 2, 3, 4 different times that your child might have that immune response. So a lot of times, though, yes, 2 pokes, 3 pokes may seem like a lot of pokes, but when it comes to those side effects, we're condensing that immune response to just be one and done.
And I will add one more thing and turn it over for concluding remarks. But what I would say is the studies that have been done on thousands and thousands and thousands of people were done at the intervals that we're recommending the vaccines be given, that the American Academy of Pediatrics is doing, is telling them these are the right times. So that gives us even more peace of mind that this is a good interval in which to administer these vaccines. And if you spread them out because of fear or doubt, being cast by a lot of misinformation, not scientific studies, that's just not how the studies are done to track their impacts. They're still going to be safe, but it's just another layer of peace of mind on that. So we've gone through the questions. I will turn it over to all of you to do your concluding remarks.
Sure.
Yeah, I'll make a little concluding comment first. I will refer that particular question back to, I referenced that Denmark study where they did look at that of siblings of children who had already been diagnosed with autism, who had a change in how their vaccines were given, spaced out, et cetera, delayed, and there was no difference in the incidence of autism in those populations. And as those stories are always compelling and sad, and they concern us as pediatricians. And similarly, there's our populations where children are developing normally, and then they what feels like suddenly develop symptoms of autism. And that occurs at any time during child development, right? So we expect some of that to occur in time, coincidentally, with vaccines, but there hasn't been an association where that's above what we expect at other times during child development. I mean, autism is a very big puzzle that we are actively trying to figure out, with lots of studies being done on that. I will say, I think we all appreciate, I certainly do, with my 6 children, that it is a very stressful time right now to be a parent. And one of the things I think about with vaccines is that there are a lot of things that are just out of our control. I mean, I worry about how much microplastic my child is getting exposed to. I worry about the addictive problems of video games and YouTube, and I worry about bullying on social media, and I worry about, will my child have chronic illness or childhood cancer? Like, there's so many things that are out of my control, and I feel weary for parents that this is now also put in that category, because really this is one where I know that I can prevent these terrible illnesses in my child. And as a pediatric ER doctor, I have great fear and respect for these illnesses. And this is like a check the box, like I have done this for my child, I have prevented these for my child. And that doesn't need to be one more added thing of parental anxiety in a world right now that there's a lot of anxiety in parenting.
Yeah. So Brendan, why don't you give our concluding thoughts from today?
All right, sounds great. So as we conclude today, the first thing that we all want to convey to each and every one of you is thanks. Just like Vivian was talking about, in a world where information is flying at us a million miles an hour, each and every one of you have chosen to be here to participate in conversation. Today, you've heard some of the most common points of information. You've learned about the robust monitoring systems that protect us, and you are aware of the reasons behind why we have chosen to vaccinate against these specific diseases. And we know that your love for your children is deep and powerful, and we know that what you want most is for your child to be healthy and safe. We want the exact same thing. I have a personal story when it comes to vaccines, and that starts with one of the most important people in my life, my mom. For most of my life, my mom has not had a functioning immune system. And I was taught that getting my vaccines was the best way that I could help protect my mom. And that was always a powerful point to me as a child and as I was growing older. I knew I was protecting myself, but I was also protecting those around me that I love the most. And as I moved into my clinical career in pediatrics, I saw the effects of vaccine-preventable diseases on children. After seeing children going through cancer treatment die from something preventable like chickenpox, it showed me the importance of the discussion that we are having today. Those children died because they wanted to go to school with their friends and to be like any other kiddo. They just wanted to be normal. And unfortunately, going there, contracting these vaccine preventable illnesses were what killed them. We are having a powerful discussion in this country on the concept of public health. That's what we're talking about. It's not just for one child or one family. It's for all of us. Like I said, my 10-year alarm on my phone went off today that said, hey, you need your Tdap. So I want to protect myself, of course, from tetanus, but I'm here to protect those small babies that I care for from something as dangerous as pertussis. Medicine, like all science, is ever evolving. That is a beautiful, beautiful thing. We discover new cures, therapies, and yes, we even find out that we might need to change the way that we do things. And that's a strength of our system. It's not a flaw. But we just want to take one last opportunity to thank you all for joining us today. And thank you personally for keeping the conversation going.
Thank you.
Thank
Thank
you.
you.
And I put a link to those papers and the studies in the meeting chat if people want to look at those links. And they do highlight some of those autism questions that was in the chat.
Great. Thank you, everyone. We hope you have a wonderful evening. And thank you again to our presenters. And we'll see you next month.
Great. Thank you for having us.
Thanks so much, everybody.
All right.